Thanks everybody for coming today. I'm Beth from the Immigration stream in the Policy Studies PhD program at Ryerson. My background's actually in social work, and the research I'm talking today is much more related to my MSW thesis, although it is still related to my Policy Studies dissertation. It's based on some analysis I did in a stats course last year, and it's kind of a work in progress, so I'd really appreciate any feedback at the end of it on how to improve it. What I'm going to be talking about today is support for immigrants in Canada, and specifically predicting social and emotional support for immigrants in Canada. So if I ask you, just to kind of go back to basics, what is support for immigrants? I bet there'd be a huge amount of variety in what you'd each think of. Some of you might think of financial support, some might think of social support, some might think of emotional support. What you think of may or may not depend on whether you come from poli-sci, from geography, from social work, well, from sociology. As a social worker, I like to take an interdisciplinary approach and bring everything together. I don't like to kind of like be siloed in one or the other. But the importance of support for immigrants has been well documented in the literature across a range of disciplines. Individual studies on immigrants have argued that support can help with a variety of things, including but not limited to easing the financial burden, finding housing and employment, helping with childcare, increasing political participation, and maintaining continuity and culture. Research has also argued that emotional support has a protective capacity during times of intense stress, and therefore can increase resilience to migration stresses and improve the mental health outcomes for immigrants and refugees. As a personal aside, I have to bring this in because it's so recent, and to be honest about my own location as a researcher, I actually just became a Canadian citizen last week. So I've been thinking a lot recently about all of the support that I've received over my 9 years so far in Canada. And as I was kind of going through these different types of support that immigrants received, I was like, yep, all the way down for all the different types of support I know I've received personally. Going back to the research, however, it's also important to note that it's been argued that different types of support don't necessarily make up for each other. So, for example, it's been found that if somebody's lacking in emotional support, immersion in a social network doesn't necessarily help the loneliness. So there's a deep field of both qualitative and quantitative research across a range of disciplines that has looked at the benefits of support during the immigration and settlement experience. But what is it that actually predicts access to that support? The studies I've been talking about, many of which have been of specific immigrant populations, have detailed how immigrants access support in a variety of locations that can include family members, employment networks, educational networks, or community networks. But much research has simply assumed locations of support and not looked at a broader range of factors that may influence access to support. For example, much of the research on the benefits of emotional support has assumed families to be the source of that support, often with the tendency as well to define family using the Western nuclear family concept. Investigations that deliberately look at support as the dependent variable rather than the independent variable, that is, studies that try to establish what predicts support rather than what support predicts, are much more limited. And this is the case for both migrants and the broader population. Some small-scale studies have been done. These have suggested that there can be different predictors of different types of support. For example, they've argued that being a couple increases access to emotional support, while having a social network increases access to social support. It kind of makes sense, right? But they've also argued that other factors may affect access to different types of support, and some factors they've suggested include linguistic isolation, connection to one's cultural community, gender, employment, income, age, and physical and mental health. Finally, it's also been theorized that immigrants find it easier to access social support than emotional support upon arrival in a new country. But as I said, most of this research has been small scale and qualitative with specific populations, such as elderly immigrants or immigrants from a particular country, which brings me to my study. So for this study, I took a different approach. I wanted to take a broader quantitative look at what predictors for support were across the immigration population in Canada. The rationale was that if support is indeed beneficial for immigrants, it'd be useful to know where that support comes from so that we can try and work on increasing access to support. So my overarching research question was, what are predictors of emotional and social support for immigrants to Canada? More specifically, I was interested in whether there's a relationship between presence of family members in Canada and social and/or emotional support, and whether predictors are different for social support and emotional support. The study was based on hypotheses developed from the literature that social and emotional support are differently predicted, that there are a range of predictors that impact social and emotional support, and that family and household are important predictors of social and emotional support. I'll just explain, I chose to focus on social and emotional support in particular, rather than the other types of support that I've mentioned, mainly because these are the most closely related to my own research interests. In the past, I've done research, including in my MSW, and worked with immigrants who are separated from family and who've talked in great depth about the emotional impact that this has had on them. So I was interested in looking at the other side, looking at the flip side, and seeing whether immigrants who are with their families report access to social support, to emotional support. I wanted to look at social support, mainly because emotional support is often kind of categorized as just simply a subset of social support, and I was interested in seeing whether this is justified or whether they should be separated out. The analysis was based on data collected through the Longitudinal Survey of Immigrants in Canada, or the LSIC, which some of you I'm sure all know about, which I accessed at the Stats Canada Research Data Centre at the University of Toronto. For those of you who aren't aware of it, it was a large-scale survey done by Stats Canada between October 2000 and September 2005 of immigrants who'd arrived in Canada aged 15 years or older. Data was collected for the survey in 3 waves, 6 months, 2 years, and 4 years after a respondent had become a new permanent resident in Canada. 7,716 respondents completed all 3 waves of data collection, and of them, 6,804 were included in the regression models here. The dependent variables that I used, one for emotional support, one for social support, were both taken from wave 3, which was the only time those particular questions were asked. So that's 4 years after they'd arrived. The dependent variable for social support was based on a question that asked, from how many people could you ask for help in Canada? And then there was a more detailed but quite broad explanation of what help meant. The dependent variable for emotional support followed up on the social support question and asked, how many of them would you say you feel emotionally close to? Both of the dependent variables were log transformed because they were positively skewed for the linear regression. The independent and control variables that I used were based on factors that I've already discussed, identified in the literature as possible predictors of social and/or emotional support, and fell into 4 groups: household and family, immigration and settlement experience, community involvement, and demographics. Some of them I'll just mention I had to recode because there were small numbers in certain categories. So now to the findings. Just quickly on some of the more interesting descriptive statistics. In terms of the dependent variables, the mean number of people from whom immigrants felt they could ask help was 1.89, while the mean number of people to whom the immigrants felt emotionally close was 1.2. I'd love to see how that compares with the general population, but that's like an entirely different study, right? On household and family, the vast majority lived in single-family households where both adult partners were present, but 22% lived either in multifamily households or in a household with no other adult family member, which could either be, this was one of the ones that I had to recode, either be as a single head of family or with other adults who were not related. The mean number of members in the household was 3.68, and the mean number of members younger than 15 years old was 0.93. 60% of respondents had no other family in Canada outside of their household, or if they did, they had no contact with those family members, while 29% communicated with other family in Canada at least once a week. On community involvement, as kind of the name I've given it, 60% of immigrants said they interacted at least weekly with their neighbours. Around 30% had participated in the activities of a group or organisation, and a similar number had volunteered, while 60% reported helping other immigrants to adjust to life in Canada. I've not included the immigration and settlement and demographic stats just in the slide, just for expediency, as they fit what I'm sure most of you know, just in terms of regions of origin and that kind of thing. So on the regression results, you probably won't be able to see this, but I'm going to go through the most interesting aspects. I've broken the models down into 3 sides. So I have the one model for social support, the one for emotional support. The results on household factors generally support the hypotheses, but with some nuances. So compared with living in a single-family household, living in a multi-family household has a positive effect on access to both types of support. On the other hand, having no adult family members in the household has a negative effect on access to social support, but no significant effect on emotional support. The more members of a household overall, there's slightly higher access to support, but different for the higher the number of household members under 15 years old, the less access to support. Contact with family members only has a significant effect when it's frequent, and daily is better than weekly. The effect here, which is positive, is greater for social than emotional support. On immigration and settlement factors, one thing that I found interesting here that I wasn't necessarily expecting is that different settlement destinations seem to have different effects on access to support. So compared with those who lived in smaller cities, cities of less than 1 million, which I used as the reference group, those who settled in Montreal reported lower access to emotional support and particularly lower access to social support. On the other hand, those who arrived in Vancouver or Calgary, Edmonton, Ottawa, Gatineau, which I grouped together, reported higher access to social and especially emotional support. But there was no significant difference for those who settled in Toronto. Speaking the language only had an effect on social support, but not emotional support. And having friends outside one's own ethnic group also improved emotional support and, to an even greater extent, social support. On community involvement, all types of community involvement led to higher levels of both social and emotional support. However, for interaction with neighbours and helping other immigrants, the effect was much stronger for social support than for emotional support. And then finally, on demographics, the biggest effects in both models were related to place of birth, with those born outside North America, Western Europe, and Oceania, all reporting lower levels of access to social and emotional support. For some, but not all regions of birth, there was quite a difference between social and emotional support. Women reported lower levels of access to social support, but there was no difference in terms of emotional support. And in contrast to some of the research that's already been done, age was only a tiny predictor of social support and wasn't significantly related to emotional support at all. So what does this tell us? Well, generally, the findings provide some support for my hypotheses. There's a whole range of factors that predict social and emotional support, and while some of them overlap, some of the variables predicted one but not the other, or had a greater effect on one or the other types of support. The most important predicting factors were related to geography, first place of birth, but also settlement destination. However, presence of family members and other social networks did have a larger significant effect compared with some of the other factors in the models. Some of the variables that have been cited in the literature as affecting support, such as gender and age, only had a minimal impact or none at all. What does this mean? Well, obviously, first and foremost, I'd say more research needs to be done, for example, in relation to the geographical differences. In terms of programs for immigrants, there's both a variety of areas in which the findings suggest access to support could be bolstered. For example, by encouraging not just formal participation in organizations or volunteer activities, but also by promoting contact between neighbors. The findings also suggest that particular populations and immigrants in particular locations may be in greater need of programming to boost access to support than in others. Finally, I just wanted to mention some of the limitations. A big one's attrition from the LSIC. So that's people who completed the first 1 or 2 waves, but not the third. I also need to mention that the dependent variables measured perceived access rather than actual access, although there has been research that says that, at least in relation to emotional support, it's the perceived access that is important rather than the actual access. And then also that the number of people doesn't take into anything qualitative, obviously. So just to summarize, 3 key points that I would like you to take away, that many intersecting factors influence perceived access to social and emotional support, and not always as we might expect. Different types of support seem to have sometimes have some different predictors. And if we agree that access to support is beneficial for immigrants settling in Canada, we really should be doing much more research on where and how they can access it. And that's it. I think I was within my 15, right? Yeah. Thank you.